And then just a little push right here.
Oh! Oh my god.
Okay, let's get started. So tell me a little bit about the low back to mid back pain that you're feeling.
It kind of feels like it's just compressed.
Okay.
And like the pain is bad when I lean into it and like extend my spine.
Okay. Is it mainly when you're leaning to the right, or is it leaning to the left and to the right?
It feels better to lean to the left.
Okay.
It's basically just like crunching motions.
And is the pain on the right or is it on the left?
It's only on the right
Okay.
side.
And does it does it start here and work its way up?
Yeah.
Okay. And when is it moving the most?
Moving, like the pain. It's kind of just it doesn't really move.
It doesn't move. It's that whole area.
Yeah.
Okay. And then when do you feel it the most? So is it only when you're leaning into it, or do you also kind of feel it when you're seating or standing or doing yoga, things like that?
I feel it when I'm doing yoga in certain poses that are crunching.
Okay.
And then if I'm sitting for long periods of time.
Okay. And crunching, extension?
Yeah.
Lateral flexion?
Yeah.
Okay. How long has
not crunching like this, but just like
extension of the back?
Yeah.
And then lateral?
Yeah.
Okay. How long has this bothered you for?
2 years.
2 years.
Yeah, and nothing happened.
Okay.
It just kind of started all of a sudden.
No mechanism of injury.
Yeah.
Okay. And then so you said that you tried physical therapy. What did they do for you?
They said it was the source of the problem was my hips were unaligned and like one leg rotates out more than the other.
Okay. This one?
Yes.
Okay. Unaligned. Okay.
And then my left glute was weaker.
Okay.
So it was like straining the right side.
Okay. And so did you do the exercise they gave you? How did you feel after that?
I felt better, but it wasn't healed.
It wasn't like enough.
Yeah.
Okay. And then you also tried acupuncture. How did that feel?
Kind of the same. It helped for a little bit, and then it came back.
Okay. Okay, that makes a lot of sense. Anything else you want to work on today? I know you mentioned the shoulder, so tell me a little bit about that.
This happened pretty recently. I would say like a month.
Okay.
I feel like it was something like forearm or handstand related.
Okay.
Like I think I just may have fell wrong.
Okay. Where is the if you could point to it with one finger, where would it be?
One finger?
Yeah. Okay. Okay. So it's right in the middle. Can I touch? Like right there.
Yeah.
Okay. Do you have pain when you're breathing in or out?
No.
Okay. Do you have pain when you're moving your shoulder in different positions?
It's not necessarily pain, it just feels uncomfortable and like
Okay.
something's off.
Okay.
Like I feel like I have to keep like going like this.
And then nothing works.
Yeah.
Do you ever self-adjust where you're cracking your own neck?
Yeah.
Does it crack?
Yeah.
Okay. Does it feel good after?
Yeah.
Yes. Okay. Okay.
I like got kind of like
Yeah.
addicted to it.
Yes.
But I don't want to be doing that all the time.
Well, I usually say, so we have areas of our spine that move really easily, and then we have areas of our spine that don't, actual vertebrae. And so when you're cracking your own neck or your own back, you're cracking the areas of your spine that move really easily. When I'm going in, I'm doing the complete opposite. So I'm finding the areas that aren't moving at all, and that's where I'm applying the force. Because it's usually the areas that don't move that feel sticky and yucky. So that's really what I'm targeting with that.
Cool.
Anything else? Headaches?
No.
No. Neck pain?
Yeah, it goes up into my neck.
It goes. So it kind of starts there and then moves up
Yeah.
into the neck. Does it move down the shoulder at all?
Yeah, maybe.
Okay. Have you done anything that makes it feel better? Ice, yoga, heat.
Stretching definitely helps a lot. And then like self-massage with those balls.
Okay.
Like laying down
Okay.
and doing that.
She's the best patient. She knows all the exercises. Okay. How often are you doing that?
Like every day.
Okay. So you're using the ball between...
Yeah, it helps for the day,
Okay.
and then but I have to keep doing it regularly.
Okay. And then you did a little self massage. That was okay too.
Mm-hmm.
Okay. Anything else you want to look at?
No.
Okay.
That's all.
So mainly the right side of your low back, and then the left kind of upper shoulder in between your scapula area.
Mm-hmm.
Okay, let's get started. So I'm first going to take your blood pressure just to get a basis of your health, and then we'll get started. So I'm going to have you, I'm just going to roll this up. And do you have a primary care doctor?
Yeah.
Okay. How often do you go see them?
This one's pretty new, so I've only seen her about 3 times in the last...
Do you have any past injuries that I should be aware about?
No.
Any surgeries? Any hospital visits for any reason? Any medications?
Mm-mm.
Okay. Are you on any supplements?
No, not regularly.
Okay. You're a happy girl. And then what are you doing your day-to-day? Like, what does your normal day look like?
I sit in the office all day.
Okay.
And then I try to go on walks probably like 3 times a week.
Okay.
And then try to do yoga daily.
Okay.
That's not what's happening though.
That's I know, it's hard. So it's mainly walking and yoga.
Mm-hmm.
Do you do any other form of exercise?
No, not right now.
Okay. No strength training, anything like
Mm-hmm.
that. Okay. Did you stop doing, have you ever done it?
Yeah, I used to do it a lot. And that could also be what contributed to the back pain.
Okay.
So I was lifting pretty heavy.
Okay. But it's still going on even though you're not lifting.
Mm-hmm.
When did you stop lifting?
About 2 years ago.
Okay.
Same time.
Same time.
Mm-hmm.
So did you have pain while you were lifting?
Yeah.
Yes. And you probably stopped because it was painful.
Yeah.
I hear that all the time. Okay, well, let's see if we can get you out of pain so you can get back to it if you want.
Yeah.
I always think it's a good thing.
Yeah.
Okay, I'm going to have you first, we're going to go through some range of motion. So I'm going to have you stand up for me, and you can face me over here. Hands to your sides. I'm going to have you lean into one side. You can start with either one. How does that feel?
Not good.
Not good. Okay. Where is it still on the whole
It's just
right side?
right here.
Can I feel?
Yeah.
Right there?
Yeah.
Or more right there?
Both.
Okay.
And up.
And up. Okay.
Yeah.
Let's go the other way. So here and then towards this way. How does that one feel?
This is fine.
That's fine. Okay. Let's do a twist. So hands here and then turn towards the spines. Anything there?
Nope.
And then towards the flower.
This hurts my upper or mid back.
Your mid back. Point to me where. Okay. So more like into your rib cage.
Yeah, a little bit in. Yeah.
Okay. Right there.
Yeah.
Okay. And then let's have you hands behind your back and then lean back for me. Anything there?
No.
Okay. And then hands here and then bend forward like a forward fold. Anything with that one?
No.
Okay. Let's have you sit back on the table. Cross your hands over your chest. I'm going to come around and give you a hug, and then I'm going to be pressing on your low back. So I'm going to lean you back and then press right there. How does that feel?
Felt fine.
Okay. Was there pain there?
No.
Okay. And then here. What did you do? You can relax your hands. Did you play any sports or?
I did gymnastics
growing
up. It definitely messed up my low back a little bit.
Okay. Okay. How did I know? Okay, let's look at the neck. So I'm just gonna come here and you can mirror me. So here. Any pain or tightness with that?
It's a little uncomfortable.
Where do you feel it?
Right here.
Okay. And then this way?
That feels good.
That side's okay.
Mm-hmm.
Okay. And then towards the windows?
Still
tight.
tight. Yeah.
Okay. And then towards the wall.
That feels fine.
Okay. And then up. And then down.
That feels fine.
And as I mentioned before to you, when you're looking away and you're lengthening that muscle, if it's muscular pain, usually that muscle's gonna hurt, right? When you are leaning away and you feel it more on that same side, so I call it closed angle pain, then that tells me it's more osseous, so it's more bone on bone. It's actually like the joint that has a little bit of the dysfunction. So that kind of deciphers if chiropractic's a good fit for you, or if you're just a little tight and you gotta go get a massage. So that's kind of the way that I differentiate if I'm gonna do more muscle work or if an adjustment will really clear it. Let's do a little range of motion with this left arm. So just bring this arm up above. Any pain in that spot between your shoulder blades?
No.
And then in front of you? Anything there? And then out here? And then here?
That's all fine.
That's all fine.
Yeah.
Okay. Okay, let's get started. So I'm going to kind of explain to you a little bit about what's going on. So this is a model of a spine, okay? So if this were me, I'd be looking like this. So we have bone, bone, disc in the middle, spinal cord in the back, and nerves are coming up. What's going on with you is when you're in extension a lot of times, so I see this often in people who are dancers or did gymnastics growing up, you're in a lot of extension. So if you can imagine, this is me. Flexion is forward, extension is back. So when you're in extension, this bone and this bone are grinding on each other. So they're grinding on each other, and that's going to cause a lot of irritation within that area. And if you can imagine, there's muscles that are attaching to the bones. So those muscles are also going to become tightened. So it's a common thing within people that are very prone to extension. So what I'm going to do for you today, I'm going to have you go face down on the table. And then from there, we're going to start with the flexion distraction. And then I'm going to work through certain muscles and things like that. I'm going to keep...
You need me to like take off my sweater? Or
what do you have under there? Just
a
t-shirt?
Long sleeve.
Okay. Yeah, you can take that off. I'm going to do one more test on... your neck before I have you go face down.
Thanks.
Yep, you're all good. So just look straight forward for me. I'm going to press down on your head. I want you to let me know if you have any pain down your arms or down in this area.
Okay.
So right there, I'm just going to push. Anything with that?
Nope.
And then I'm going to bring you here. Anything with that one?
No.
And then over here. Anything with that?
No.
And then forward. Anything there?
No.
Okay. And then one more. Go face down for me. And then you're going to put your hands right here. And then straighten your elbows like this, but press into here. It's like an upward facing dog. A little bit more. All the way up. More upward. Yes. How does that feel on the back?
Feels okay.
Is this the position that usually bothers?
Yes, but it's more like I would have to extend more.
It would have to be extended more.
Yeah.
Okay. How much? Go up a little bit more. You have to be like that.
Yeah.
And then you feel it.
Yeah.
And is it still mainly on the right?
Yeah.
Okay. Let's go face down. Okay, let's get started. You can put your arms to the side. I'm going to also put a little bolster underneath your ankles. So just right here. So you've never been to a chiropractor, huh?
Nope.
Crazy. Are you excited?
Yeah, I'm so
I
excited.
know. So every chiropractor practice is a little bit different. Everyone kind of has their general flow. I consider myself more so a catch and release chiropractor, meaning you're coming to me with a certain pain or discomfort, and we are getting you better as quickly as possible. So I'm coming up with a treatment plan that it's going to take in order to get you to the point where you no longer have that pain. And then from there, if you want to continue coming in, once a month, maybe twice a month, for wellness care just to prevent any injuries from coming back, then you totally can, but it's not something that's necessary. How's this feeling?
Very nice.
Very nice. It's the best. So this table is called the flexion distraction. Essentially, it's gapping the joints in your back. So if you can imagine that joint that was rubbing together in that little model that I showed you, this is gapping that. So it's putting less pressure on that part of your spine. So it should feel really good. If there's anything that ever feels like it's too much, you can always let me know, okay? And have you ever had cupping?
Yes, I did it when I did acupuncture.
Okay. What did you think of it?
I loved it.
You loved it.
Yeah.
Okay, then let's do some today. Did they do it on your low back?
Yeah.
Okay. Perfect. We can do that, no problem. So do you have a good day or a busy day or a slow day?
It was just busy.
Yeah.
Yeah. We had a company lunch today though. We have it every Thursday.
Okay.
That's nice.
That is nice.
Mm-hmm.
What'd you have today?
It was from a barbecue place, but
Oh.
I don't eat meat.
Yeah.
So I just had all of the mashed potatoes and mac and cheese and
Oh.
salad.
That sounds good. Where did it come from?
Something stone fire?
Firestone?
Firestone, maybe? I
Okay.
don't know, I've never heard of it.
Yeah.
It's a carp thing.
Okay. It is a carp thing?
Well, maybe
I've never heard of
I
it.
think I'm saying the name wrong.
Okay. I've never heard of this place. I do like barbecue.
Mm-hmm.
Well, that's really nice. That's a huge perk.
How was your day?
It was good. Yeah, nothing too crazy. Just some patient care and, all the usual things.
Mm-hmm.
Yeah.
I've been slammed with yoga homework.
Yeah. I haven't started it. Is it a lot?
Yeah,
Yeah.
because of the break.
How is your sequence coming along?
For practicum 3?
Yes.
Oh, I haven't started that.
Okay.
I started the quiz though.
Okay. You're a smart cookie.
I actually thought it was due this weekend.
Yeah.
And
And then
I'm
it
so
wasn't.
relieved it was
Yeah.
not.
I know. I was gonna say I haven't done it yet, so you're all good. How was your Thanksgiving?
It was so nice.
Yeah.
To my aunt's house.
Is she in town here?
Mm-hmm.
Yeah.
My whole family lives in Santa Barbara. And my cousin just had a baby.
Aww.
We got to see her.
Cute.
Mm-hmm. How was yours?
It was good. We also just stayed here. My parents came into town now, so that was really nice.
Aww.
Yeah, it was really, really nice.
Fun.
Went to our neighbors, hung out. It was really good.
That's great.
Yeah. It was really nice to just have a weekend, and I took the Thursday, Friday off, so I had a 4-day weekend. Have you ever had any x-rays or MRI of your back?
No.
Okay.
I was thinking about getting an x-ray.
Yeah. Just to see?
Yeah.
So usually, it depends on what's going on, obviously, but I usually wait a little bit before I recommend any imaging, unless I'm suspecting a fracture or something a little bit more serious, and go through a trial of conservative care. And then from there, if you still aren't feeling better at all, then we would either do x-ray or MRI to get a better idea. Chances are it's, those joints rubbing up against each other, and that would show on x-ray.
It would on an x-ray?
It would.
Okay.
Yep. So you'd be able to see that they're rubbing against each other and that there's a little bit of degeneration in that area.
Okay.
So if that's something you want, I could totally order you an x-ray and we could take a look and see.
Yeah. Yeah, I think that would be good.
And then have you been working on your pelvic tilt at all?
Yeah,
Okay.
definitely. I had a really bad anterior pelvic
Yep.
tilt, and I have been working on correcting that the past couple of years.
Okay.
Also, my gait and physical therapy.
Mm-hmm.
Been working on that a lot.
Okay. What have they said's wrong with your gait?
I don't press off on the balls of my feet enough.
Okay.
And don't have enough. I kind of sink into my hips.
Okay.
So just keeping them level, but still having that range of motion.
Okay. Well, we'll see how you feel after being adjusted.
Yeah.
How does that feel right in there?
Good.
Okay. Not too tender.
No.
So I'm just putting pressure. So within our muscles, we have areas that have trigger points. And essentially what that is it's an area of the muscle that is accumulating like all the stress, all the tension of that muscle. And then so when I hold a sustained pressure, it's relieving that tension that's on that muscle. There's one more right here. And you never have pain that goes down your legs or into your glutes?
No.
Okay. So I'm going to do some cups on your low back.
Cool.
So I'm just going to lift your shirt up here. And then I'm going to put a little towel underneath. And then I use some emollient, which is basically some cream. I'll just put that down first, just so it feels a little bit better on the skin.
Okay.
Did you guys do Thanksgiving food for your Thanksgiving?
Yeah, except we had salmon instead of turkey.
Okay.
There was also turkey, but
Yeah.
had the salmon option. And then we made some apple pies.
Oh. From scratch?
We cheated a little bit with the crust.
Okay.
We bought the crust, but then we made the rest of it.
That's okay, that still counts.
Yeah.
That's still homemade to me.
Yeah.
Let's do a bit on the sides here. Yeah, I was shocked this year of how many people don't do a real Thanksgiving. They do whatever they like. Like I've heard a lot of ribs, tacos, pizza, like literally whatever they like. I was like, this is so interesting.
Yeah. I think it's great.
Yeah. Like you gotta do what you like to do. Doesn't always have to be turkey.
Yeah.
Because at the end of the day,
I've never really liked turkey.
does anybody like turkey? I feel like nobody likes turkey. I mean, I don't mind it by any means.
I've never heard anyone enthusiastically be like,
yes,
love turkey.
like I don't love turkey. It's okay with cranberry sauce.
Cranberry sauce is way better.
Yep. It needs it. It's usually dry.
And I do love gravy.
Yep. I do love stuffing.
Not a fan.
Yeah, that's my favorite. How are you feeling in this glute?
And that one I feel fine.
Okay. So your hips do have a lot of range of motion. Like you have a lot of internal and external range of your actual hip. Do you feel like that?
I guess so.
And other than the extension and the lateral flexion in yoga, does your back or upper back ever bother you in any other positions?
Yeah, just sitting.
Just sitting.
And standing for long periods of time.
Okay. Like when you're sitting at work or when you're sitting like on the floor with your legs extended?
Both. Especially at work though.
Okay. Do you have any kind of lumbar support?
Yeah, I have a little back, like, lumbar support pillow.
How often are you using that?
Every day. It just is attached to my chair.
Does it feel like that's helping?
Yeah.
Okay.
For sure.
How are these cuffs?
Feels nice.
Yeah. So you like using cups because it gives a general idea of how much inflammation that you have. The cups are bringing blood flow to the area to increase the circulation, help that muscle heal. And so the redder that area gets, the more inflammation and blood flow that was pulled into that area. So it usually tells me how tight that specific muscle was. So that's a great tool. Okay, let's see. Any pain right in here?
No.
Okay. Or on this side?
Nope.
Okay. So I'm going to adjust your upper back first. So you're just going to stay exactly the way you are. you bring your arm kind of through this hole to the sides. And I'm going to have you take a deep breath in, and you're going to blow all the way out, and then I'm going to push on your back, okay? So deep breath in, and then all the way out. All the way, all the way. Good. How was that?
That was nice.
That was nice. You could feel it, huh?
Yeah.
Okay. Any pain in here? No. I'm going to do one more right in here, so breathe in, and then all the way out. All the way, all the way, all the way. Good. A little bit more, huh?
Yeah.
Not bad?
That was great.
Okay, good.
Feels so good.
Perfect. I'm gonna have you come onto your right side. You're gonna face me over here. So this one's a little bit funky, but you're gonna be on your side, and I'm gonna kind of move you into the position you want you. So bring that up for you. So the bottom leg's gonna go long. Good. And then the top leg's gonna go bent like this. Have you ever seen these videos?
Yeah.
Okay. So you know kind of what to expect.
Mm-hmm.
So here and here. So from here, I'm just gonna find that spot that's not moving. Okay. We're gonna be right there. And I'm just gonna roll and then drop, okay? So roll. How was that?
That's so cool.
So cool?
Yeah.
Okay, then come on your back. There was a lot there, huh?
Yeah.
Yeah. There was a lot. Okay. Face this way now. And do the other side. So same thing. So the bottom leg long. And then this leg bent. And then cross. Perfect. And so this one I'm going to put my hand up a little bit higher in here. So see how this kind of maybe feels a little yucky for you? My hand's going to be there. So just here, roll. Good. It's a little different, huh?
Yeah.
Okay, and then let's go on your back. Okay, legs long. Well, you never have any hip pain, right?
No.
Okay. And have you noticed that your foot flares out when you walk?
Yeah.
Yes.
It does.
And is it this one?
Yeah.
The right one? Okay. So I'm going to come in and work on the front part of our hips.
Mm-hmm.
When we have more of an anterior pelvic tilt and we're like this, these muscles, our hip flexors or psoas, is lengthened. And it puts a lot of tension there. So I'm going to work on those here in the front, okay? So it's that muscle in there. So what I'm going to do for this is I'm going to bring your leg in, apply the contact, and then lengthen it out like that. So I'm first going to be in here. So it's going to go in, and then it's going to go out. So you feel that?
Mm-hmm.
Okay. So in, and then out. And then in, and then out. Not bad though. Okay. One more. And then out. I'm going to do a little bit down here too. So same thing, so right here. And then I'm going to bend here. So here, and then bend. Any pain? No. Okay, one more. Okay. Keep you there. Let's go to the other side. Did you still have kind of that foot flare, or not as much?
Yeah.
You still had it. Okay. I'm gonna grab this foot right here. Hold up. Okay. That looks better. So I'll put these over here. So I'm gonna do one more for your mid back, for that spot on this side.
Okay.
So I'm gonna do from this part. So I'm gonna have this one like that. You're gonna look this way for me, and this arm is gonna hug me here. So you just want this arm to be a dead weight. And I'm gonna put my hand kind of on the side of your back here, and take a deep breath in, and then blow it all the way out, all the way, all the way, all the way. Good. It's a little one. Relax there. Okay. a look at your neck. So I'm just gonna do some ranges myself. So I want you to give me your full head, and I'm gonna move your head. Any pain with that?
No.
Okay. Any pain with this one?
Nope.
Okay. And then here, and then here,
No.
and then here, and then here.
No.
Okay. Let's see what we have. I'm just gonna feel some muscles. So yeah, so this feels really tight to me. Do you feel that too?
Yeah, it is very tight.
Yeah. So we're gonna work on those. And then a little bit in there in your pec as well.
Mm-hmm.
Okay. So that checks out compared to this side, that you would feel that tension on that left side of your mid-back, just because all these muscles are pulling a little bit.
Okay.
So I'm gonna first just start with some muscle work, okay? So I'm gonna come to this one that was the tightest, so right in here. I'm gonna hold it, and then I'm gonna move your head up. You're gonna be so relaxed after this.
I'm already relaxed.
Okay, good. So here, here. And then one more with this one. And then right there a little bit too. So here, and then here. And here.
It feels super tight.
Mm-hmm. You can feel that, huh?
Yeah.
And you don't ever have any headaches?
Yeah, I do,
You
but
do?
I
Okay.
don't know if they're related to the neck pain.
Okay. Yeah, so I see a lot of success with people that have headaches
Mm-hmm.
because some of it is, different factors like not drinking enough water or hormonal or things like that. But sometimes it actually is, muscular tension or stress. And so we carry a lot of stress and tension within our shoulders and these specific muscles that I'm working on you. And so that can cause an increase in headaches as well.
Mm-hmm.
Let's see this side. So, not as bad over here, but still a little bit.
Mm-hmm.
One more. I'll work here a little bit of these muscles. Okay, so as I'm feeling around, I'm feeling for the spots that aren't moving. So this moves pretty good. This one not as much. Can you feel that?
Mm-hmm.
So when I apply my pressure, I'm going to be applying it right there.
Okay.
So same thing with this and this. This one doesn't move as good. So I'm going to start with the left side, okay?
Okay.
So I'm going to find that spot. I'm going to place it there. And I'm going to lean over to one side, okay? So just right here. And then just a little push right here.
Oh! Oh my god.
How's
That
that?
felt crazy.
Crazy, huh?
Yeah.
Little push, that's all it takes.
Yeah, wow.
Yeah. You weren't expecting it,
That's
huh?
incredible.
Yeah, okay, good. So let's do this one right here on this side. So here, just roll you over. So same thing. So just bring you to that spot. And then a little push like here. Oh, good. Perfect. How are those?
Amazing.
I know. They're the loudest ones because they're the closest to the ears. That's right in there. And then I got a little bit of your hair on me.
It's okay.
Into my necklace. I'm going to do a little bit of work here on your pec muscle. left-handed?
No.
Okay.
I'm right-handed.
And at work, are you doing a lot of desk work? Okay.
The whole time.
Is
yes.
it writing or is it typing?
Typing.
Okay.
Lots of mouse clicking.
Okay. Lots of mouse clicking. So forward and then back. Any pain with this?
No.
Does it feel tight to you?
Yeah, a little
Like
bit.
if I bring it out a little bit more here?
Yeah.
And then down there too. I'm gonna go under into your armpit. And then out. It's okay?
Yeah.
Okay.
Feels tight.
Just a little tighter. And bend. And then out. And then one more. Okay. I'm gonna have you now come sit up for me and see how you feel.
I feel like a new person.
Okay, good. Swing your legs over there. I'm gonna do a little bit more, I'm gonna do some scraping on your traps. So on the low back I did more of the cupping. On the traps I'm gonna actually use that tool and move some of that inflammation out of the way, okay?
Okay.
So you can put your hair up or just move to the side, that's good. So just towel down. Okay, take this arm and cross it over your body. Yep. Any pain with that?
No.
Okay. Okay, good. You can relax that one down. And let's move your hair to your other side. Perfect. Here. Here. And then so same thing, but just a little bit more towards the traps. Perfect. Good. Okay. Okay, Missy, you're all set. So you might feel a little bit sore from this. That's completely normal.
Mm-hmm.
It shouldn't last very long. It's usually, if you're gonna have it, you might feel a little bit sore like tonight or tomorrow, but then after that you should feel really good. So you should feel like your range is a lot better. You should be able to move into that side. So stand up and see how that feels when you're moving into that right side.
Oh yeah, that feels a lot.
A lot better. Yeah. So we're just gapping those joints, bringing movement into there. What I would recommend, let's first start with the upper body. So what I would recommend is for you to find a doorway when you're at work. Find a doorway, hand here, and then stretch out. So actually stretching out your pecs. You can do this on like a bed at home and go to the edge and then open it up like this. Or if you're at work, you can just use a doorway.
Mm-hmm.
If you have access to a foam roller at home,
Yeah, I have one.
yeah, you can always put that, so if it's right here, you can put it down on your back like this,
Okay.
and then bring your arms up here like a T,
Mm-hmm.
or like a Y, and let your arms hang.
Okay.
So that's also another really good one. It'll allow to kind of isolate that thoracic spine and bring your arms out. You'll feel that stretching in the pec area. And then for the low back, so ideally I would like you to kind of avoid situations where you're arching your back too much.
Mm-hmm.
So like when you're in a full upward facing dog, I don't want you doing anything that's going to aggravate that pain. So if that's bothering you, then I would rather you not do it.
Mm-hmm.
Essentially what we want to do is, instead of you being more in a anterior pelvic tilt, being more in a posterior pelvic tilt.
Mm-hmm.
So things like strengthening, your hip flexors, your glute med, that's really going to help, which I'm sure the PT gave you. One exercise that I love for the hip flexors, did they give you any hip flexor work?
I don't think so.
Okay, so
Well, they gave me one that was like laying on my back,
okay,
like this, and
Okay.
then I would press.
okay.
I don't know if that's hip flexor.
Yeah, that's a little bit. I'm going to give you one a little bit better. So what you're going to do is you're going to go onto the ground, put something on the ground. So it has to have something with a little bit of a height. So you're going to put that on the ground. This sounds really silly, but you're going to be here, and then you're going to take one foot and bring it over,
Mm-hmm.
and then bring it back. and then bring it over. I don't want you leaning too far back, but I want you to be like sitting up straight like this, and then bring it over and then back.
Okay.
And then you should feel it right here in your hips. So that's going to strengthen the anterior part of your hips, and then just help with the tilt.
So those are hard.
They're hard. They're super hard. So I would start with that one. You can also do like a glute bridge where you're on your back, lifting up, to the point where you're contracting your glutes, but you're not going into like a full wheel.
Yeah.
If that makes sense.
Yeah.
Do you have any questions?
No.
Okay.
That was so nice.
Okay, good.
Yeah, I love that.
If you feel a little sore, you can always do heat or ice. But I feel like you should probably be okay because you're young, so you're good. Yeah, like your body feels really good. So, great. Okay, awesome. We're all set.